Hello everyone, welcome to this short video about Dupuytren's contracture. In this video we're going to talk about the most important things to know about the disease. Dupuytren's contracture is a common fibroproliferative disorder that targets the palmar fascia of mostly the fifth and the fourth finger. It occurs due to thickening of the fascia that surrounds the tendons in the palm. The etiology of the disease is still uncertain, but there are some factors that are associated. Number 1, genetics, as 2 out of 3 people with the disease have some genetic predisposition towards the disease. Number 2, Northern Europeans and people with Nordic ancestry have a generally higher chance of getting the disease. Number 3, and factors that are actually possible to do something with, are those that can cause ischemic injuries to the palmar fascia. To name the most important causes for this, recurrent trauma to the area, which is especially seen in manual laborers, alcohol abuse, smoking, diabetes, and liver cirrhosis is important to know. The diagnosis is made on the clinical presentation. There are 3 main stages of Dupuytren's, and the symptoms depends on what stage the patient is currently in. The first stage of the disease starts as a small lump that can be felt in the hand. The lump or the nodule is usually felt just below the start of the fingers, but it can be felt anywhere really. This is the earliest sign of Dupuytren's and it may progress later. When the disease spreads along the fascia, it forms a cord. This thickening of a fascia forms a cord because it goes around the one flexor tendon. The cord will spread from the palm and up to the finger or fingers. As the cord gets tighter and tighter, the finger or fingers affected will be progressively more flexed. When it gets severe enough, the patient is unable to straighten out the finger or fingers. This is the typical presentation of Dupuytren's. Now to treatment. Dupuytren's is never dangerous, but what it can be though is limiting towards the function of the hand. In mild cases where the function isn't much affected, there is no need for treatment. In more severe cases, but to mention it again, it is not dangerous, there can be a need for treatment. Treatment is indicated when the disease quite heavily affects the function of those fingers. This is typically done when the patient are unable to extend the finger or fingers. There are 2 main ways of surgery. The first and usually first attempted variant is to continuously puncture the tension band until it rips open. Sometimes a clear pop can be heard when the band is ripped. This is done under local anesthesia, and the syringe that is used to give the anesthesia can also be used to repeatedly puncture the fascia. Just to illustrate, when doing fasciotomy by needle puncture, it is important to try to not puncture the tendon itself. The fascia is supposed to be punctured, but if the tendon is also punctured repeatedly, it can decrease the strength of the tendon, and this can over time lead to rupture of that tendon. Remember, Dupuytren's treatment is done to improve the function of the hand, but by destroying the tendon, those fingers affected will be useless. So if you do this, the fingers will be more useless compared to before. The second variant, which is usually done if fasciotomy is expected not to work or after it is attempted and doesn't work, is fasciectomy. That's an open surgery where the skin is cut open and the affected area is cut away. Thank you for watching. I hope it has been educational. If you have any questions, feel free to post them below. Cheers!